This is Susan. She just volunteered for a clinical study. Susan feels good about contributing to the development of life-saving research, but like most people these days, she has a job and a busy schedule. Also like most people, Susan uses her mobile phone to help her manage her schedule, communicate with friends, family, and work more efficiently. Luckily, Susan's study is using Mosio. Mosio enables research staff to efficiently create and send personalized appointment reminders, helpful alerts, and simple surveys directly to Susan's mobile phone, all via two-way text messaging. Not only that, but Mosio contains predictive analytics technology to let staff know if Susan or any of her fellow participants might be losing interest in the study, helping to keep retention and engagement high. Mosio for Research, mobile solutions for clinical research. For more information, visit www.mosio.com/research.
Hello everyone, this is Noel with Mosio, and I'll tell you a little bit today about our patient engagement platform. So first, some key benefits. Number one is it was designed to be patient-centric, to work with the increasingly mobile lifestyles of the average person in the United States and around the world. Number two is that it increases engagement and retention. And number three, messaging controls. So it's very much IRB friendly. Once you have IRB approval for the messages that you're going to be sending out, we can lock down elements of the system so that those stay there and remain consistent. And then finally, visibility for managers and coordinators from either a site level or a higher level for clinical trial managers to see how things are going in their studies. The four core components that we have in the system are appointment reminders, storyline alerts, which we'll explain here in a little bit in more detail, surveys, and then predictive analytics. So how we avoid drop-offs and increase retention when someone's enrolled through looking at some of the behaviors in these mobile components. So a real quick look at the appointment reminders dashboard. You can see here it shows you choose when to send the appointment. You can choose the day before, the day of, or you can send an entire batch, and I'll show you the CSV upload here in a sec. The reminder message, this is where you enter the little first name code, and then you can enter date and time. So when you choose that time with them or when you upload it via CSV, it will pick that time and then send the message that way. The confirmation text that you send after they reply yes is customizable, as is the no response. Storyline alerts is one of our most powerful features, mostly because of the flexibilities that it allows researchers in terms of the content that you're sending and when you're sending it. So you actually have the opportunity to create different types of alerts that you send out, but then also create linear messaging so that you can start those messages in steps when you enroll patients in a study. Now, the many uses within the storyline alerts, compliance reminders, dosing reminders, patient education, motivation and support, delivery of surveys, and then there's also gamification elements that you can add. Really, the power of it is that it's a content delivery template that you can utilize in whatever ways you deem as best. Any type of information that you want to be able to collect in a survey form, with Mosio you can create, deploy, and receive information back via text message. So all the normal survey questions that you ask, you can design within our system, and you'll see here these examples on the dashboard. There's a yes or no question in the first one, free response, A through E, and I'll show you what it looks like when you add a new survey question. You just start typing. Got your 160 characters there, and then you choose the type of question that it is, and then click Add. The predictive analytics features within the Mosio system are something we're very excited about because it helps increase retention and reduce dropouts by measuring patient engagement levels within the system while they're using it. So here on the predictive analytics dashboard, you get an overview of a little snapshot of the patients and where they are. We've got 4 example patients here. You can see on this that 3 of the patients have high engagement levels. You can see where they are, that they're currently active, their start dates, And then there's Susan here, who her engagement level appears to be low. She's had 2 missed surveys, no response to an appointment reminder. Might be about time to give Susan a call and figure out where she is with things. Now, it's entirely possible that all could be okay, but at least you have a heads up before it gets too late so that you can rectify the situation, get any questions or confusions out of the way, and get her back on track. In some cases, you have a number of different sites that you're managing. In this case, they have a dashboard view of all the sites they might be running, and they can quickly see how those sites are doing very simply. In this case, Site 1, Site 2 doing okay, and in Site 3, it might be time to put a couple of phone calls in and figure out what's going on ahead of time before things get particularly dangerous. We do have plans for future development within this system. A couple of those things are link tracking as a component of predictive analytics, also CTMS integration, additional channels, so IVRS, email, and then delivery of incentives via SMS, so promo codes, coupons, or gift cards, things like that. So that's it for the Mosio Patient Engagement Platform. If you have any questions, please let us know. Hope you enjoyed the demo, and we look forward to hearing from you soon. Thanks.